everyone. Thank you for coming to our second Public Health Power Hour this particular season. We are in our second season, and I am so excited. This Public Health Power Hour series is all about our alumni and everything that they are willing to teach, willing to explore with you all, providing different resources as far as career development, workforce development, and just sharing their journeys of how they got where they are, just in case anything piques your interest. And today we have with us Miss Sharon Pritchett. She is an alumni, and Miss Sharon has 20 years of experience in national health security, biodefense, and system preparedness. So I'm excited that she's going to join us today. She's worked for places like the Henry M. Jackson Foundation for Advancement of Military Medicine. I know she's at Emory as well. So I'll let her tell you a little bit more about what she's doing and where she's going and how she got to where she is. And then, of course, if she has any resources to provide, she will do that as well. So without further ado, please welcome Miss Sharon Pritchett. Thank you, Sharon.
Thank you. I appreciate the introduction, Natalie. Hi, everybody. Thank you so much for coming. I appreciate y'all being here, especially to a talk that you don't have to be at and during your lunch hours. So thank you sincerely for being here and for having interest in this. I hope I say a few interesting things, and I hope we have a good discussion at the end. So thank you again. Again, my name is Sharon Pritchett, and I was one of the first 4 graduates from GSU's newly established MPH program back in 2005. So it has been 20 years. I was originally at GSU as a sociology student working in the joint master's PhD program there. But it just really wasn't clicking as well as I wanted it to. I really wanted to focus on what I have the terminology for now as social determinants of health, and not quite feeling the fit, and just happened to come across one of GSU's announcements about this new program that they were starting in public health. And I looked at the curriculum and I saw the word social determinants of health and classes on health behavior theories. And immediately within the week, I filed the paperwork to switch majors and have not looked back since. I will say that my foundation, my undergrad was in sociology, so that has definitely served me well. I'm a big advocate for integrating human sciences, of course, in public health, because we're working with humans and people and trying to understand, behaviors and actions, and it's very important. Over the past 20 years, I have worked across HHS, primarily CDC, as well as the Assistant Secretary Preparedness Response. I've worked across multiple agencies in DoD. I'm currently in DoD right now as a contractor. And I've also supported academia. Where I am right now is actually an academic environment, but one of my first jobs out of grad school was actually at Emory. So I've had a lot of different experience across multiple sectors.
Sharon, quick
And
question. Sorry not
yeah,
to interrupt you. Are you sharing your screen? We can't see it.
you know what? I just realized that it was not showing up, so bear with me while I do that. But
Oh,
we're just introducing, so you haven't missed anything extremely important yet. Here we go. And my talk today is going to be about from the classroom to crisis response. Here we go. All right, here we go. Here's me. All right. So again, 20 years across of public health leadership across the government in academic space as well as private space. So I've seen a lot and had a lot of different experience. Back in my day, when I was in grad school as well as undergrad, it was the early 2000s. So those were the days of 9/11, anthrax attacks. I was sitting in an environmental health class one night when Hurricane Katrina was passing through. And I, like a lot of people, wondered, how do we stop outbreaks? How does the government respond? And, it was something in the back of my head, and it's turned into a side quest, kind of turned into a career. I should also mention, of course, the 2003 SARS and monkeypox. I didn't think those were going to happen again. But I had some great stories from professors here at GSU, and it just really brought my interest into the field. And the further I've gone, it's been an exciting career. It's been a challenging career. And I would really love to inspire more people to join me working in public health emergency management, in health security, or just in public health leadership. Because I need, as someone who does a lot of hiring in the field over the past couple decades, I need to hire great people as well. And whenever I see someone that has graduated from GSU, I think, hey, there's my alma mater. So we would love to continue to see y'all in the future in your resumes as we are hiring. My path has been anything but linear over the past couple decades, but it has been purpose driven. Today is about how you can take what you're learning at GSU and build a public health career that is impactful and aligned with your values. This is meant to be a practical conversation, not theory, and I'll share lessons from the real world crises, transitions, and I hope that you'll walk away with strategies that you can use right now and in the upcoming few months or years that you have left for graduation. As we mentioned, I'm currently working as a program manager for the Henry Jackson Foundation, which is a nonprofit, as a contractor in support of DoD for the Uniformed Services University School of Medicine. So, big mouthful, a lot of different coverage there. And I manage over $15 million on a couple of different projects. One looking at the impact of COVID on the military healthcare system, and one on maternal health. I am also, as I believe mentioned, working on my doctorate at Emory University in public health emergency management, which is a new program for them. So I am guinea pig for GSU, guinea pig for Emory, and hoping I can bring a few of y'all along for the ride. Our goals today are to, well, I'll start by let's ground ourselves in what we're doing today. Our goals are to talk a little bit about how to break into public health, how to find your niche, and how to grow into leadership roles, even before you have a title. I'll also share some of the hard parts, the ethical dilemmas, the burnout, and what it takes to stay aligned with your mission when things get messy. My goal is to leave you feeling like you are both equipped and a little bit more empowered today. So we will explore a few opportunities across sectors. We'll talk about real world strategies and some challenges. The public health landscape is a lot bigger than most people think or consider. I don't know if any of y'all have places where you're currently working or places where you're looking at working after graduation. But generally, these fall into four main categories. So, as we're talking about these, please give yourself a moment to think which one feels like it might be the best for you. Starting with where you might land in the government. You might wind up supporting federal, state, local, or tribal health. These are typically considered to be the engines of public health. You might wind up at a nonprofit or an NGO, which is non-governmental organization. These are usually focused on advocacy, global health, or community-based organizations. These are often leaner, more value-driven. Several different examples of these around Atlanta, and these might be things like the American Cancer Society or places that specialize in global health. These are usually, other than the government, I would say what most people think of in public health. You might also continue in academia or research. This includes think tanks, applied research centers like the one I'm in now, or policy institutes. You might also wind up in the private sector, working in healthcare systems, consulting, biotech. There's an increasing demand for public health expertise. So you really, the options for academia or government are not just your limitations these days. I have personally worked in all of these sectors over the past 20 years. And as I mentioned right now, I am working for a nonprofit as a government contractor in an academic setting. So these can also be a hybrid type of opportunity. And chances are that over the course of your career, you will work for multiple institutions and across multiple sectors. So flexibility is important. One thing I've definitely learned. There are several emerging fields right now. One is health security, my personal favorite. Biosurveillance is very important in all of the major public health institutions right now. Public health preparedness. And another one of my favorites, One Health. One Health, to me, combines the social determinants of health and the social ecological factors of and human factors with what's happening environmentally and with the animals as well. Because animal health, of course, impacts things like your flu outbreaks, H5N1. I really don't think that there is a way to separate the environment, the animals, the plants, the people, and how we respond or are vulnerable to outbreaks. And this applies for most public health emergencies. So how do you get there? I want to stop for just a second and point to this little picture on the what is my right-hand side. This is a picture from CDC's Emergency Operations Center in the director's briefing room. Not a lot of people get to see this. It's one of my favorite places, so I just wanted to show it to you. I would give credit to the person who took the picture, but I honestly don't remember at this point. But this was taken, I believe, during an incident management meeting during the 2014 Ebola response. And this is pretty much what it looks like. And if you were to walk by in the EOC and turn your head, this is what you would see. So how do you get here or somewhere similar or wherever it is that you would like to be? First of all, be strategic. Emphasis on strategic. As you are applying for jobs, if you just apply for every single thing that is on LinkedIn and Indeed, you are going to find yourself very exhausted. So apply for things that you are the most passionate about and things that are in your wheelhouse and with your skills. Craft targeted resumes and cover letters, not just generic ones. I have found in the past couple of years that AI has been very helpful for this. I use this or don't, but I'd like to put out some recommendations for that. My personal approach is I usually have about 3 different cover letters or resumes that I use for what I would consider to be my strongest skill sets in program management and public health emergency management, and sometimes something else depending on what I'm doing or what I'm looking for. And those are the jobs that I personally would tailor or target in my job searches. Treat your practicums, your APEs, and your internships as auditions. It's not just check boxes to get your 30 hours. These are opportunities that can land you into other jobs after graduation, that can help get you references, that can build your network. My APE was at the Task Force for Global Health and Child Survival back in, I guess it would have been 2004. And I'm happy to say that my mentor there and we are still friends 20 years later. She and I still see each other weekly for coffee, for walks, or to scream about things going on. And that's been extremely, extremely helpful. We provide mutual support, and I would encourage you to look for these type of opportunities and people um, in your practicums and your internships, but in your jobs in general. The mentorship is very important. Um, Use LinkedIn intentionally. I know that for a lot of younger people, LinkedIn gets an eye roll. It's basically like a Facebook of professional networking. But when people my age are looking for hires or they're looking for what's going on in the field, I promise you, if I'm looking at hiring somebody, I look on LinkedIn and look just to see if they have a profile. If it's public, I will click on it. I will get a sense about you. And I believe that a lot of people who hire have the same approach. It's also a great way to stay connected with your colleagues, with your classmates, and to reach out to other people for new opportunities. I do it all the time. Um, Y'all are welcome to add me on LinkedIn. Just look up Sharon Pritchett. If I see you're with GSU, most likely I will absolutely not hire you, add you into my profile, into my network. Again, because building your networks and mentoring others is very important. Um, I encourage all of y'all again to build your mentor relationships with other alumni, myself, others, people who have graduated more recently. And it doesn't have to be just other colleagues and your professors, your internship points of contacts. I also have a wonderful professional coach, very lucky to have her. And she's one of the first people that I go to as I am navigating this field. So, using LinkedIn, go to conferences like APHA. There are so many different conferences in public health to attend. Go by the tables, talk to vendors, talk to schools of health. This is one of the things that I love the most, and it helps promote your visibility for people who might hire you in the future or who might have more opportunities for you for jobs in the future. Even if you're not looking for something today, you might be looking for something, next week, especially in these times. So it's good to go ahead and have those connections. Um, Leverage your professors, leverage your network, because relationships will open more doors than applications ever will. Take a moment to think, if you will, right now, later today as you go about? What is one skill that you would most want to showcase in your first job? For me, it was research, but it's different for everybody. So take some time to think about that and let that be your guiding light. Finding your niche is a little bit more challenging. It's about alignment, in my opinion. It's where your values, your skills, as well as the public health system needs meets. I would encourage all of y'all to explore multiple tracks, such as epidemiology, policy, operations, communications, informatics. These things are also intertwined. Um, if you are really great at epidemiology, but you want to be say, a team lead within the government, within an academic center, or within a response, you still need to understand operations in order to be a great leader and to make sure things are running smoothly. You need to understand communications in order to communicate your findings and to disarm misinformation, disinformation. You need to be able to present your data to different audiences. These are all intertwined. So the more skills you have and the more you understand how they play across each other, I believe the better that you'll do, and the more that you'll be able to refine what it is that lights you up inside. I also tell my team all the time for years to build cross cutting skills. Um, Traditionally, these may be project management, grant writing, data literacy. I'm going to emphasize grant writing because your ability to fund yourself or to find funding or to tie into getting funding is one of the biggest leads to job security that I can tell you. So look at that. There are several free classes that are available online. And if you would like to reach out to me after this, I'm happy to provide you the same list of free or $5 grant writing coursework that I provide to my current team. There's also a lot of free training and project management if you would like to go down that path. Data literacy is so important. And if there are areas that you're aware of where maybe you haven't had that experience or you want to build your experience, then consider filling those gaps early, using your internships to fill those. Um, for example, right now, I'm doing a little bit less policy work than I have at other parts of my career. So, one thing I do is I'm volunteering as a policy analyst for a veterans organization and tracking legislation at the federal and state levels. Um, it gives me a weekly experience in policy analysis. And I'd like to think that as I continue in my next 20 years of career, that that will come in handy. I'd also like to put in a plug for working with the Medical Reserve Corps. I am currently, and for the last 10 years, a member of the DeKalb County Medical Reserve Corps. And we're basically a core group of people within the community who, if there were an emergency response or an emergency need, we work on the planning, the training, and the response in different capacities. Just about every county in the Atlanta metro has them. So if you're in Cobb or Douglas, Clayton, Gwinnett, Fulton, I promise you there is an MRC near you. These are great ways to apply your epidemiology, policy, whatever skills it is that you have, as well as to plan and train for what you might do if there were a public health emergency and when there's a public health emergency, because I can guarantee you that you want to know these things before they happen. And no matter where you are in public health, no matter which sector you're in, you will probably touch in some way health security and supporting emergency management. Uh, and it's a great way to also build your public health community and again, your network. Although my own career has pivoted several different times, my missions never changed, protecting communities. And again, adding to your reflections for now, for later today, for thinking about this tonight, think about an area of public health that pulls you, even if you don't know how to get there yet. Once again, my field didn't really exist 20 years ago when I was a student, but it is here now. And I'm so grateful for the experience and the stepping stones that I've put in place to get here. I'm still not exactly where I want to be yet. There's still a lot of dreams. Keep dreaming and keep finding your way to where you want to go. Growing into leadership. Some of y'all may already be leaders in your teams, in your areas, or you may want to go into leadership. Or honestly, when I was a grad student, leadership was not really the first and foremost thing on my mind, but here I am. And in addition to what I'm doing now, I've led teams over 50 people, over 5 agencies, which was too much. But you will, as you continue down the road in public health, you will find yourself 10 years from now, 20 years from now, maybe 5 years from now in leadership roles. And it's important to be building those skills now. Leadership isn't just a title, it's a posture. So take initiative wherever you are, whether you're a student, whether you're in whatever role you're in. Volunteer for projects. Again, I'm using the work I do, policy analysis and with the MRC as examples. Be reliable and calm under pressure. It's especially important for leadership because if you're not calm, your team is not going to be calm, and the people around you may be also impacted by your lack of calmness, to put it nicely. So self-regulation is one of the most important skills as a leader. I've served in multi-agency responses, several, 10 years of responses, where trust and humility mattered more than hierarchy. Leadership is also about resilience, knowing when to rest, when to delegate, and when to say no. I'm going to tell you that burnout sucks. It sucks very badly. You don't want it. You don't want to go through it. So when I say resiliency and rest, I'm not just saying words that are buzzwords. I'm telling you that if you don't build resilience in yourself, in your team, and in your organization, you will suffer and pay for it. I would like to emphasize that it's also hard to have your own resilience without resilience in your team and in your organization. You can't have one without the other. I would encourage you, if you're interested in working in emergency responses or health security, to learn from high pressure multi-agency environments. High pressure environments are not for everybody. You don't have the same leisure of learning things at a slower pace in response as you do in normal operations. So build yourself up to that. And again, one of the ways we do that in emergency response is planning and training and exercise, as we do in the MRC. Finally, mentorship. Find it, give it, sustain it. That's why I'm here today. That's one of the things I've appreciated the most in my 20 years, again, from my mentor, from my APE, and from my professional coach. I don't necessarily want to tell her name because I still want to make sure that I have coaching sessions available in her schedule. But if you are looking for someone, I'm happy to pass along her name privately. She was one of Fauci's nurses back in the early days of HIV, and she worked in laboratories. And one of the things I love the most about her is that I don't have to explain to her why, I don't have to explain science to her. And I don't have to explain why things that are making me upset currently are making me upset. She understands, she gets it. And that's important to look for in mentors. Let's see. In, almost towards the end, staying aligned with your values. This is one of the most important things I would like to tell you because ethical issues are regular, if not constant, these days. And they come about more often than I ever anticipated in grad school. It's the part that no one teaches you, how to protect your values. I will say that mission drift is real. It's the job with a higher salary might also erode your purpose. The job that's a little bit easier might be more tempting. It might be tempting to take the consulting fee for something that is actually detrimental to the field of public health. And it's important to know what your values are and where your lines are. I recommend learning to recognize toxic cultures early, again, to prevent burnout and to make sure that you are not crying in the middle of the night over a misalignment in values. And I cannot overemphasize, especially these days, protect your mental health. Again, this is not just a buzzword. This is something that is very serious in public health right now. More people than not that I know and work with in public health have some form of PTSD. That's not an exaggeration. And y'all are coming out, graduating in a very hard time. So, sincerely protect your mental health and your professional integrity. Because I promise you, once you lose it, once things come out that maybe you're putting business in front of people, that you change data, that you, I don't know what you might do, but those are not reputational points that you can get back. So protect that and protect equity and your ethics and your resilience as non negotiables. Consider, as you're thinking tonight, what are non negotiables that you'll carry into your career, even if it costs you your job? I had a privilege last week of being in a meeting with three of the people from CDC who recently retired or resigned, including the chief medical officer and the directors of both the Division of Infectious Diseases and emerging infectious diseases and zoonotic health. You probably read about that in the news if you were not directly involved in those situations. But what they were saying was, one of the things that they said was that last March, or just a few months ago, when they were considering where was their line, what were their non-negotiables, and what could they tolerate or not, their guidelines were what is legal, What does the data use agreement say? Were things carried about scientifically? And does this pose a risk to their reputation, to their personal reputations, or to the reputation of the organization? I really don't think that I have a better list than that. So think about your own list or adopt those. It's a pretty darn good list. And you can see where they are. But I would like to say that I do deeply appreciate um, their actions to support public health and to support science. And oh, actually, I'm going to go back for just one more second. All right, so this picture on the left, I'm a little sensitive, but I'm going to share this anyway. So, this is one of the ways that I've supported my mental health the past year. I've started doing art therapy. So if you do that, add me on LinkedIn, you might see a little bit of my art. This is one of my pictures right here. This is the goddess Hygeia, which she's the goddess of health and sanitation. And just so you know, she's a big inspiration in public health. If you're at the CDC or anywhere near the CDC, you may have noticed her head, her bust, outside of the visitor center. And if you haven't seen it, then please look for it next time you're there, or if you're there. She's on another one of their campuses too. So keep a out and look out for her art around. Lessons from the field. A few hard-learned lessons from national response work. One is that systems are greater than silos. I know you probably hear about this in your classes, but success is about integration. As we talked about just a couple of slides ago, you can't have communication without policy or epidemiology, without understanding data integration. So the more you understand, the more you're able to integrate and talk to people across different sectors, different divisions, rather than isolate, the better and the stronger we will be. Preparedness also is not just it's not just a binder, it's not just a plan, it's not something in a notebook sitting on a shelf somewhere. It's something that has to be built into your workflows. We call this continuity of operations. This means how will you how will your organization, wherever you are, keep going in the event of a government shutdown or in the event of an outbreak? Um, those type of continuity of operations. Or how will you scale up and increase workforce capacity if you need to? How will you communicate if there's an internal or external emergency? I've had to do all of these things. And again, I'm going to underscore that thinking about these things beforehand and not when they start happening is extremely important. Equity. Equity is security. Um, Leaving behind communities, vulnerable populations, whether that means people with disabilities, underserved populations, maternal child health, whatever it is, leaving behind communities undermines readiness nationally, all in all areas. So consider that and consider equity in everything that you do. Finally, you're your own best advocate. No one will protect your career and advocate for your career more than you will. I know it's nice to think that your mentor or that your boss will see your value and they're going to give you great reviews and they're going to take care of you. But the reality is, you have to be able to tell people why you do great work, where you want to be, and advocate for yourself. Because if you don't, other people, they really won't. So learning to advocate for yourself I have my team do this in annual reviews and performance reviews. I kind of grade how they do their self-evaluations as part of the evaluation, because if you can't speak up for yourself, not only are you not going to get promoted into the positions that you want to be in, um, but you're not going to win grants and proposals either, because for those funding opportunities, you have to be able to say, this is why I'm great. This is what I do. These are the years of experience that I have. Um, Protect your professional alignments. As far as some resources and next steps, pause here for a minute. Again, please look for your professional associations. APHA is a great one nationally. NACHO, or the National Association of City and County Health Officials. ASTO, which is the Association of State and Territorial Health Officers. CSTE, which is the Council of State and Territorial Epidemiologists. IAEM is the International Association of Emergency Managers. These are all just examples. I'd like to say that I follow all of these on LinkedIn and or have colleagues and connections in all of these major associations, and that's very helpful to me. And it's very helpful to see what all of these national associations are saying and focusing on. So really, as you're listening to the field and as you're thinking about what opportunities are available, what is the pulse on public health right now, these are organizations to look at. Fellowships, think about these for after you graduate. Do keep an eye on deadlines, because those usually are around January, February, maybe December. So keep a lookout for these after graduation. These might include fellowships at the CDC directly or with ORISE. I love to hire ORISE fellows. There are a lot of different ones, and these are going to be super competitive in the next few years. But consider these, think about these, look for these. Continuous learning is a must. I have done this for 20 years and it makes the biggest difference. For me, AI is one thing that I'm focused on hard right now. But again, there's PMP certifications. There are so many different FEMA courses that are free and that are online that deal with the basics in emergency management and niche areas I would suggest that you look at. These are all very Googleable, but I'm happy to point you in the direction of specific courses if I know that there are specific areas that you're looking for. And again, for networking, consider these professional organizations, as well as LinkedIn, GSU's Elevate, and as many professional conferences as you can get travel funding to go to. I am going to stop right there for a second and pause for discussion, questions, anyone throwing tomatoes at me. This is your time. Questions to consider. What is on your mind right now about your career path? And what are some of the biggest challenges you're facing right now? Does anyone want to be brave and go first?
We have one in the chat. Someone asked, can you talk about ageism? She says she's representing the job field with her MPH and she wanted to know what the landscape is like. And everyone, you can take yourself off of mute to ask your question too. You all have the opportunity.
Yeah, thank you. Ageism, I'm coming closer and closer to 50. So this isn't really something I love to think about, but it's real. I've worked with people from all ages and continue to work with people from all ages, older than I am, throughout my career. I personally, I want the best person for the job, no matter what their age is. So that's how I look at it. Um, I don't think, I think one of the biggest factors from a hiring perspective that I have heard of is really more about salary expectations, because those of us who have more experience in the field, we're going to want higher salaries. If for no other reason than, there's mortgages, there's kids' colleges, it's important. But that price point is probably more of what can be a barrier, especially if you're working on contracts or proposals, I think, than the actual numeric age. That's just me. Um, Other people may have different opinions.
Thank you. Kennedy, did you want to ask your question?
No, I was actually going to respond to the questions on the
Okay,
screen.
yeah,
Okay, go ahead.
Okay, so for me, I have a background in science, and then I am a public HIV advocate, and I have been doing nonprofit work. Like took a pivot right now, and so I'm in grad school for my Master of Public Health because everybody was saying, "You're already doing the work, Kennedy. Why don't you just go get the degree?"
yeah.
I don't know what to do next. Like I don't know what I want to do because I want to help everybody and do everything and specifically what I want to do next. So that's like my biggest challenge. Um, like I tell people, I do know that when I came into the program, it was not to go work in the government sector. I love hands on the ground, working in the communities, helping the
Hmm.
actual people.
Hmm.
So I just don't know what I want to do next with the degree.
That's okay. Perfectly okay. Uh, it took me a minute to find my way as well. So, and even if you did know exactly what you want to do when you graduate, things are going to change in between now and then, and they're going to continue to change and evolve. So, that flexibility is important. For you, I would community health definitely sounds like it's important to you. So, following and looking in those community health uh, positions and careers, focus there. But I would also ask you, um, do you love infectious disease or are you flexible for chronic diseases as well? I'm going to be honest with you, I'm way more of an infectious disease person. And so that has been where I have stayed in my career. And that's just something to consider. I think most of us probably fall in one of two camps like that.
Thank you. All right, so you're getting a lot of questions in the chat. So let me scroll up. This one is from Shane. His audio's acting up. So he does have a question about how do you manage work-life balance as a public health professional?
Very carefully, one day at a time. Uh, Again, especially as someone who has gone through burnout and never wants to ever be there again, I am very protective of my time and making sure and what's on my plate and speaking up when I am too overwhelmed. I also keep things pretty simple. I I go to work, I work out, I do classes, take care of my family, um, but I don't have, you know, huge list of activities and just crazy, enormous things that I'm involved with, actually. I really try to focus my energy. And I know that saying, hey, family comes first is cliche, but genuinely, think about what's the most important to you and what, if nothing else, it's that metaphor about having the balls, juggling the balls, and which ball is it that you don't want to break. You're juggling all of these different things, right? You're juggling school, work, family, chores, all of this. What's the ball that you don't want to break? For me, it's making sure that my kids are taken care of. I'll be a day late on a paper if I need to. I'll ask my boss for an extension on a deadline, but just keeping in mind your own personal priorities, whatever those might be.
Thank you. All right, so there's another question, and guys, we are going to wrap up in about 5, 6 minutes. But Amira asked, she said she has a new interest in prevention, but she's not sure how to get into it. Anything prevention related, but her interest started with foodborne illness and health inspections. She's been networking and professional with different professionals in the field via LinkedIn. But she would like to know, how else would you suggest that she gets her foot in the door of prevention?
Well, first of all, thank you so much for that, for your interest in that particular field, because it is so needed. It is so needed. And with the government cuts to the surveillance in foodborne illnesses right now, um, it's on one hand not necessarily a field where there's might be 100 job postings for it, but what I think that's going to mean is the privatization of the food inspections and those health inspections. So I would, if it were me and I was looking for something in that field, I would look at the industries that are the most in need of health inspectors and food inspectors. Um, hey, look on the FDA website where they list the outbreaks and recalls. Those are companies that are going to need some help. Um, and helpful hint, it's almost always the companies that are involved with green leafy vegetables. Yeah.
Thank you. That's really good. You're giving great information. Okay. The next question is from Anushka. She is in the, let's see, they're in the epidemiology concentration and have been interested in going into outbreak prevention and research. They haven't had the best time trying to find research opportunities. But what would you suggest be the best advice in situations where opportunities don't match? What would you want to do?
I have a very similar interest, and one of the things about that is you don't often have the opportunity for research in prevention and response unless there's an event to respond to. So it's kind of an ebb and flow sort of a field. It is, there is a trend towards more ongoing research. And that is where I am also, I don't know, blazing a trail or trying to make my own way. So please feel free to reach out, and to anyone else who hasn't had a chance to ask a question. I would love to continue talking about how we do this and how to do that research together. And adding to that, the Medical Reserve Corps is one of the ways that I intend to get involved and to do research in the community level and the after action reviews. So look there. Let's talk.
That's really good. I know that we are getting closer to time and we've got that's exactly what I was going to ask you. If you all have additional questions, please, please, please reach out to Sharon. She is a wealth of information.